All right, everybody. So I'm going to do another clip here, brief one. I'm going to do three different questions that I've come across on various different formats and forums. The first one we're going to come across is one that a lot of people tended to be really split on, and I think for pretty good reason. It ends up being a middle-aged male with painful urination and increase in urinary frequency. Without knowing anything else, you might be thinking like urinary tract infection, epididymitis, urethritis, cystitis, prostatitis. I'm sure is somewhere in your mind there as well. They do mention later that there's pain with ejaculation, but no urethral discharge or fever. And despite the fact that this question ends up being, I don't know, about a paragraph and a half, like a lot of step two questions, you really have the information that you need just based off from those things. So the answer ends up being chronic bacterial prostatitis. And their reasoning for this is essentially that even though there is sterile pyuria in terms of, I'm sorry, even though they don't have a tender prostate, they can carry a chronic infection, so they might get these short courses of antibiotics, which technically is the right treatment, the antibiotics, but normally you'd want to do more like a 6 week course of Levaquin for an illness like this. Um, Now, the thing that people usually get split on here, or at least in this instance, the thing that people get split on is they're thinking, well, how can you tell me that this isn't urethritis, right? The urethra, of course, being the vessel for the urine as well as the semen. So if they're having pain with both of those activities and they don't have a tender prostate, how is it not that? And their reasoning behind that is essentially that you have a 30-year-old male with no sexually transmitted disease and no sign of that with their urethral discharge either. Uh, so essentially, you're left to go with the most reasonable answer, which ends up being chronic bacterial prostatitis. If the only reason you came onto this video was just to hear about prostatitis versus urethritis, you could go ahead and sign off. I do have two more questions that I wanted to go over. We do have another question that ends up being a stillborn, and there's not anything going on in terms of like ambiguous genitalia or uh, hypertension. It's not like the congenital adrenal hyperplasia. They don't give you a high drops. There's no mention of parvo. The only thing that they tell you is that the baby ends up having some limb fractures as well as a hypoplastic thoracic cavity. So then the answer for this ends up being the more severe form of osteogenesis imperfecta, which is type 2. This is one of those where there's a type 1 and there's a type 2, and the type 2 ends up being the more severe of them. Type 1 is that funny one where they'll have like blue sclera and interesting teeth, but they live and they may have like some incidental fractures here and there, but it's not to the extent that the type 2 osteogenesis imperfecta is. Okay. The last question that I did want to go over briefly was a pretty common one, and it's one that people end up getting right pretty often. So, in this particular question, they just got a new job, they're walking around a whole bunch more, and they have a stabbing sensation in the sole of their left foot. Now, it tells you that there's no pain in the back or the side of the heel, but the key finding is that when the toes are curled up like this, so dorsiflexed, it's saying that there's tenderness to the palpation between the heel and forefoot. So the answer ends up being plantar fasciitis. There weren't really a ton of other realistic options in this particular instance. Maybe if they would have made it female, could we have been maybe more worried about a stress fracture? Yeah, probably, but they're giving you this specific finding of the pain with dorsiflexion. Now, something that they don't put in this particular question that I see come up a lot is they'll tell you that the patient has a lot of pain right when they first start walking in the daytime. Um, and I've seen that come up pretty often with plantar fasciitis. Other things that you might see come up is like having flat feet or being a little bit larger. So, of course, we're looking for like BMI like 28.5 or higher. Could be like an additional sign that you might be thinking about plantar fasciitis for that particular patient. So anyways, thanks so much for checking in, and keep an eye on them. We'll probably post some more videos. Okay.